Good afternoon, I'm Dr. Deukmedjian. You're watching live surgery at the Deuk Spine Institute. Our patient has carpal tunnel syndrome in the right hand and left hand. He's a patient that we fixed his spine. Now he wants me to get the pressure off the median nerve. The median nerve is the nerve that innervates your hand, specifically the thumb and second and third finger. So the carpal tunnel is a tunnel that runs underneath a ligament that runs right here, that runs across the base of the palm. And that ligament is called the transverse carpal ligament. I use a 10 blade. You have a 10 or not? If you don't, it's fine. I'll just use this. So I'm going to make my incision in the skin. Can you see, Jacob? Skin incision. And I'm going to go down through the skin. You guys see that?
Yes, we do.
And just under the skin is fat, this yellow, fluffy, cloudy stuff. And I like to slide the fat to the side, right along the transverse carpal ligament. So I'm above the transverse carpal ligament. I can feel it. And then I'm going to put in my retractor. I do this surgery the same way every time. The retractor is this expandable retractor. I'm down on top of the transverse carpal ligament. You got to push down and hold it down, otherwise it'll lift. And then you're going to see the transverse carpal ligament right there. All right, you guys see that? That's the very superficial part of it. Man, these are the wrong loops. These are, the focal distance is too far away. All right, I'm going to make my incision in the transverse carpal ligament. Now, a lot of surgeons get confused here. You see that bit of muscle right there? Henry, I don't know if you can see that.
Yes, we can.
It's red, that's muscle. They think, oh, I've gone too deep. No, you haven't. You got to go below that because the compression of the nerve is even below that. Suck, please. You guys see that?
Yes, we do.
All right. So just to see it better, I'm going to scrape the muscle side to side. And then now this is why a lot of carpal tunnel releases fail. The surgeon stops. But there's another deeper tendon or ligament, I should say, just underneath. And that's the one we have to slice through. Okay, there's the nerve. You guys see the nerve down there? It's kind of hard, I'm sure. All right, let me have the Army-Navy thing. Yep. Now that I've got the nerve exposed on top of it, I'm going to, there's the nerve right there. I'm going to go ahead and get my scissor in here, and I'm going to finish releasing this transverse carpal ligament. Okay, you don't want to cut the nerve. So I'm going to get underneath this ligament and I'm going to lift and cut. Okay? You see that? Good. And we're just, there's the nerve right there. We're just about done. Another 30 seconds. I'm going to go the other direction. Okay? Sorry it's not a better view for you guys. I need the pen field. All right. Got to get underneath that deeper ligament right there. That should be good. You guys see the white nerve? Yeah.
Yes, we do.
Tilt the hand up a little bit. That's it right there. Right there is the median nerve. Okay, and it's freed up nicely. Hold it there. Don't move it. That feels good. No more compression. And right on top, no more compression. We're done. Now to close this, we could irrigate. You have anything with antibiotics? We're going to close it with a suture. And the technique I use is this mattress suture. And you only close the skin. We're going to use a nylon, what is this, a 2-0? You got the end? So we're going to put 4 stitches. You start wide. You stay underneath the skin. The skin is very thick. You go to the other side and come out. Reverse direction and go back. And you want to evert these close edges so they fold outwards, not inwards. The key to skin closure is eversion. And then I'm going to do an instrument tie. Okay, twice. Grab the tail, slide down. And you guys see that? See how the edges are everted? Yeah. Right? That keeps it tension off the edges, and it allows it to heal properly. It looks really weird, but I assure you it is the right way to do it. All right, cut that long. Okay, fine. And that was 1 out of 4. And then we're going to do another. Is that the compression? Is that the tourniquet?
Yeah.
So it's constantly running?
Yeah.
Is that, there must be a leak. Is that a leak that I'm hearing, or is that Dr. Bernda's Mexican suction?
Yeah.
So why would it constantly run if there's not a leak? There must be a leak, right?
No.
Oh, I see. All right. Any questions? That's fine. You guys are watching what's called a carpal tunnel release. And this is open versus endoscopic, which is done endoscopically, which is, I don't do endoscopic carpal tunnel releases because the failure rate is very high. The surgeons always end up missing the target. Yeah, these are lumbar loops. Please label these lumbar, Luis,
Yes, yeah.
because the focal distance is too far for this.
Yes, sir.
Any questions, Henry?
Yes, we have a question from Stuart on Facebook
Hi, Stuart.
saying, what the heck, when did he start doing carpal tunnel stuff? I never heard of that before with Dr. Deuk.
Well, thank you, Stuart. I am a neurosurgeon. I don't know if you know that. There's 2 types of spine surgeons, neurosurgeons and orthopedic. I'm a neurosurgeon. I do brain surgery, I do nerve surgery, and part of the nerve surgery is carpal tunnel releases. I don't do a lot of carpal tunnel release because, well, to be honest with you, I don't really try to. It's sort of a simple surgery that a lot of other doctors do. But the truth is, they don't do it right. And I've seen so many botched carpal tunnel releases done by other surgeons that I've decided that when I have my own patients, like my spine patients, I will gladly help them and do their carpal tunnel release, just as a favor to the patient, so to speak. But I'm not trying to do more of these. Does that make sense? I like to put my talents where they're best served, doing spine surgery, but for my special patients, I will do their additional types of surgery that would need me to do, that I'm qualified and capable of doing safely and well. So, welcome. We're done. 4 stitches, and you've just watched my carpal tunnel release. Again, the skin is tented up. It's supposed to be that way. That's the way you get tension off the edges. It heals the best that way. And we're going to get those sutures out in 2 weeks. 2 weeks. I leave them in for 2 weeks. All right, remember when you remember how to do the wrap, right? Yeah. So you got the tweeners on every finger, and then put a big gauze ball right there. And then when you do the ace, don't crush the fingers together. You can even cut the sides so it doesn't put pressure. All right, thanks for joining us for this carpal tunnel release.